3 years ago in NHS Lothian, our board committed to making quality the driving force underpinning all we do. After 2 years developing our approach through successful pilot programmes, the board approved a 5-year strategy to make this business as usual throughout the entire organisation. We're seeing real benefits for patient and staff experience and significant impacts on our overall performance. Here are just a few examples of quality improvement and innovation in NHS Lothian.
Our Flow Centre combines technology and innovation to allow us to really have a situational view across NHS Lothian, both within our adult acute hospitals and actually across the boundaries into primary care, local authority provision and even third sector. This system, this telephone call centre system, allows us to coordinate the referrals in from primary care and identify the best route in to the fastest access from our clinical teams. Developed over the last couple of years, this has been seen not only within NHS Lothian, but actually across NHS Scotland as an example of exemplar practice. This system allows us to not only identify incoming referrals, it allows us to look in real time at how busy our front doors are. And it allows clinical decision making to flow patients to different areas to maximise the immediacy of access. Something that's been recognised by our clinicians as being incredibly powerful.
With the Flow Centre, we now have other transport options available to us, so we can utilise the correct vehicle, not necessarily an emergency ambulance. This means that patients have started to present to the department earlier and in a more controlled manner, as opposed to all at once. We also have more availability within the senior clinical decision-making team earlier in the day, and access to allied health professionals such as physiotherapists and occupational therapists.
Last year we were all hit by the beast from the east, and actually part of our resilience saw this Flow Centre coordinate not just the flow of patients across our acute sites, but actually allowed us to transport staff and patients safely from their homes to the hospitals, and as importantly, from the hospitals to their homes. This has been an outstanding example of clinicians working closely with our leadership teams and using technology to deliver a better service for patients.
Ageing is a fact of life. For most of us, getting older inevitably means becoming more frail. But we know there are things we can do to delay or prevent frailty. Data innovation is helping us do that. eFrailty uses existing data we already have from GP records to find those in our community who are at the greatest risk of becoming frail in the future.
It is shown to be a reliable predictor for 1, 3 and 5 year risks of hospitalisation, nursing home admission and mortality. Now, for the first time, it's a risk stratification tool that's really utilising the potential of the GP record.
This programme allows us to intervene at a much earlier stage. It won't stop ageing, but it could prevent frailty.
With regards to the mildly frail, we're looking at a low cost intervention with the Red Cross.
So we do have opticians that can come to the house and do this.
NHS Lothian is leading the way as one of the very first places in the world to do this on such a grand scale. Introducing quality in mental health was the first time that NHS Lothian had applied a quality management system across a major healthcare service. Our mental health care is made up of many diverse services, all with their own focus.
In the last 2 or 3 years, I've found it's been one of the greatest assets to allow us to engage with staff at every level. In terms of trying to encourage people to take responsibility for their own improvements, this has given us a real methodology to do that.
One of our first projects was to look at consistency of approach around triaging referrals coming into the service. We worked with GPs as key stakeholders, we worked with schools, and we changed our process for the way that we were dealing with referrals by changing that pattern, so trying to pick up those children and young people that probably didn't need specialist treatment at an earlier point in the pathway. We've been able to reinvest that assessment time into treatment time.
So we identified that there was a difference between patients' presentation within the clinical environment and out within the community setting, and the difference in the patient's presentation really inspired the staff to think of more ways to promote activities within the community rather than in the clinical environment.
It was something that was really easy to measure because the fun factor of doing these nice activities that have such a huge impact on the clinical care of the patients was easy to see and measure clinically, because the one-to-one observations, or what's called the constant observations, dropped dramatically. Incidents dropped dramatically.
There are well over 100 coordinated quality improvement projects across mental health.
What has surprised me, genuinely, is the scope, the systematic nature of the quality improvement. I've seen that, but I've seen it across not 4 projects, I've seen it across 50, 60, 70 projects, all focused on making it better for the people we serve. Your particular cohort happens to be mental health patients, users and carers, but it goes far, far beyond that to the joy and happiness of your workforce as well. The people I met seemed to be enjoying their work, seemed to be articulate about what they're hoping to improve, and for those they serve, that's got to be better.
In NHS Lothian, we believe and invest in quality improvement to provide the best care today and sustainable health and social care for tomorrow.